Now we can quickly pick up the exceptions. Staph, strepto, gram-positive cocci ho gaya. Now we pick up the exceptions, that is venom. I'm going to start off with the first exception, that is Neisseria. And Neisseria includes two things, as all of you know. Neisseria meningitidis and Neisseria gonorrhea, as the name suggests. Tell me, Neisseria meningitidis, meningitis karayega kahan se? Normally it's an inhabitant of what? Normally it is an inhabitant of nasopharynx. And Neisseria gonorrhea, gonorrhea you know genital infection hai, it's an inhabitant of the genitals. What disease does it cause? So for the disease, obviously mota mota, so if I tell you, you will say ma'am meningitis will cause meningitis and gonorrhea will cause gonorrhea, which is nothing but a sexually transmitted disease, but that's not it. I want to elaborate on this a little. Please note that Neisseria meningitidis causes something known as, agreed with you, meningitis, but does it cause something in the adrenal glands? Bilateral adrenal gland problem. What is that? Bilateral adrenal hemorrhage called Waterhouse-Friderichsen syndrome. We all have studied it is because of meningococcemia. This is what will be written in the paper. It is because of meningococcemia. So remember, bilateral adrenal hemorrhage, Waterhouse-Friderichsen syndrome. Meningitis to dekho sabko yaad hai. This is what you have to learn. What does Neisseria gonorrhea cause? Again, gonorrhea everyone will learn. But what apart from gonorrhea? What consequence of gonorrhea? So of course, gonorrhea, when I say and you say, ma'am, it is a sexually transmitted disease, I ask you what is the most common presentation in males? You will say urethritis. And the most common presentation in females is cervicitis to begin with. After that, vaginitis can occur, males may prostatitis, seminal vesicles, epididymis, everything can be affected. I'm telling you most common things. Males may urethritis, females may cervicitis, and when it goes advanced, it can result in water can perineum. There are discharging sinuses, multiple discharging sinuses that are created like a water can for watering the plants. Multiple pus points are there in the skin in the perineum through which pus comes out. Now, tell me, if a child is born in a mother who is having gonorrhea, will the child have, while passing through the birth canal, can the child's eyes get affected? Yes, ophthalmia neonatorum is positive. Iska complication kya hoga? There is a very famous syndrome called Fitzhugh-Curtis syndrome. Fitzhugh-Curtis syndrome, pehle to you should be knowing hota kya hai. It is nothing but an involvement of the liver. It is a perihepatitis. And secondly, it is also seen with not only Neisseria gonorrhoeae, it is also seen with Chlamydia trachomatis. I'll show you this, I'll tell you this in Chlamydia trachomatis also. It is nothing but what? Fitzhugh-Curtis syndrome. It is going to show you involvement around the liver. If they show you a liver specimen and they say that, okay, this is a liver specimen and it has fibrosis or perihepatitis, something around it, that is Fitzhugh-Curtis syndrome. What else? Neisseria gonorrhoeae ended up happening everywhere in the body. Disseminated gonococcal infection, disseminated all over the body. That is what is gonorrhea. Jaldi se recap. Meningitis causes meningitis, common sense, but other than that, Waterhouse-Friderichsen syndrome. Gonorrhea causes gonorrhea, but what is it? Urethritis in males is common, cervicitis in females is common. In children, mother to child, ophthalmia neonatorum. As a complication, Fitzhugh-Curtis and the disseminated infection. Now coming back to the table, I've told you the diseases. Now let's talk about the fermentation. So now see, gonorrhea only has G in it. So the fermentation is going to be for glucose. Whereas meningitis has G, so fermentation of glucose yahan bhi hai, but M also, this means maltose. So remember, there is a maltose plus there is a glucose fermentation in meningitis, whereas in gonorrhea there is only a glucose fermentation. Coming to the shape, meningitis, the way you write M, you can make a lens out of it. Also, you will make a capsule around it. This means meningitis is also going to not just be lens shaped, meningitis is also going to have a capsule around it. Gonorrhea, I've written one G like this and one G like this because it's going to be a kidney-shaped organism. Next, I told you space being made. I told you, both of them are catalase positive. Remember, both of them are oxidase positive also. Let me show you the oxidase test that is done. This is an oxidase test which gives you a purple color. When you get a purple color, that is indicative of an oxidase test, and that is positive in both Neisseria meningitidis and Neisseria gonorrhoeae. Please note, Neisseria meningitidis is a strict aerobe, whereas gonorrhea becomes ulta. That is a facultative anaerobe. The story is not over. The table is continuing. Now you need to know what are their virulence factors. So now I realize virulence factor same lag raha hai, ma'am. Both of them are having IgA protease. Both of them have endotoxins in them. Yes, because they are gram-negative. Gram-negative organisms have endotoxins. Both of them have pili. Oh, is there something special about this pili? Yes. This type 4 pili that both of them have, pili is never for movement. Movement के लिए क्या होता है? Flagella. But can they show you motility because of this? Yes, we have noted that there is an element of motility that is seen along with Neisseria sometimes because of this type 4 pili. Now coming back, both of them, इन दोनों में से capsule किसके पास था? You will say, ma'am, meningitis had that capsule. So who will have capsular polysaccharide as a virulence factor? Meningitis. What are the serotypes? ABC. ABC तो याद रहेगा. Y and W135. ABC, Y and W135. What is the point that they really ask you in the exam over here is that please note that we know that there is a meningococcal vaccine. When we are talking about a meningococcal vaccine, it is going to provide protection. So meningococcal vaccine किस से बनता है? It is made from, what are the serotypes? ABCY W135. You will say, ma'am, meningococcal vaccine has everything except B. Basically, B is not there in the meningococcal vaccine. So they ask you that this vaccine does not provide protection against. It does not provide protection against serotype B. That is why we are having a very important MCQ over here. So remember, meningococcal vaccine does not provide protection against the B wala serotype. Rest it provides protection against all these capsular polysaccharides. So A, C, Y, W135. But capsule is only in Neisseria meningitidis. It is not in Neisseria gonorrhoeae. Both of them have something called outer membrane protein. Okay. But Neisseria gonorrhoeae has protein 1 and protein 2. Even if you don't learn all of this, please note protein 1 has something called pore B1A and pore B1, protein 1, pore B1A causes disseminated gonococcal infection. Important for INICET aspirants. How I have learned it is pore B1A is going to cause a lot of infection. A lot of infection matlab disseminated infection it will cause. Okay? So now one thing you should know that meningitis has a capsule wala problem and gonorrhea has the disseminated pore B1A wala problem. Rest both of them have IgA, both of them have endotoxin, both of them are going to have pili. That is common. Dono ka transport media is also the same. There is something known as the Ames or the Stewart media. The Ames or the Stewart media, which is a charcoal based media, that is going to be a transport media to both of them. And what is the culture media? Culture media is also the same. It is the modified Thier-Martin medium. So I'll write it in a continuation. It is a modified Thier-Martin medium which I can use for both of them. What is modified Thier-Martin medium? See, pehle we used to say Thier-Martin medium. Now we've said modified. Something extra has been added. So please note, till the time I was using these three things, vancomycin, colistin, nystatin. Vancomycin, colistin, nystatin, it was Thier-Martin medium. Now I've added an extra T to it. When I've added trimethoprim to it, now it has become modified. That could be a question. The addition of trimethoprim has made it a modified Thier-Martin medium, which I use for meningitis and gonorrhea. Finally, the treatment. IV ceftriaxone is for both, of course, but please note that for Neisseria gonorrhoeae, genital infection, other than IV ceftriaxone, you will also have to give up the azithromycin. That is something that is extra over here. So remember, IV ceftriaxone for both, and for gonorrhea, it is also going to be azithromycin. I hope you've been able to understand this in the form of these two tables. One table I made for all of you, which was to do with all the biochemical things. One table is to do with all the virulence factors and its media and all of that. Finally, we come down to not only Neisseria, one more was there, Moraxella. Do Moraxella jaldi bata do. There is something known as Moraxella catarrhalis. As soon as I say catarrhal means something to do common cold, cough, all of that, ENT wala problem. So there is going to be otitis media. Moraxella catarrhalis causes otitis media. Also, it causes COPD exacerbations. Guys, if you have a case of emphysema or chronic bronchitis, the most common infection that you have in COPD patients, no, it's not Moraxella. It is Haemophilus influenza, the most common infection in COPD patients. But now if I ask you, the second most common infection that you have in COPD patients, and that is going to be Moraxella. Can you see if there's a colony formed? I'm taking a loop and I can't show it to you because it's a static picture, but this, if I put pressure, that colony will move forward. Just a hockey khel rahe ho. This colony will now come and sit over here. Then you'll push it a little, this colony will come and sit over here. This is known as the hockey puck sign. That could be a fancy question for Moraxella catarrhalis. Whereas there is one more Moraxella. What is Moraxella lacunata causing? Lacunata, you can see the picture in front of you. It is causing angular conjunctivitis. That is a question that you get in ophthalmology. Yes, on that note, you have wrapped up all of your gram-positive cocci as well as gram-negative cocci. But now do you know what are we starting with? We are starting off with the bacilli family, and I have already taught you this. All the bacilli are gram-negative except McDonald's. We have studied this mnemonic. Now out of this, what I'm going to tell you first is the very, very famous Corynebacterium and diphtheroids. The D and D is what we are going to pick up. Corynebacterium, diphtheria and the other diphtheroids. Then we'll first finish off the exception wala list. I'm not going on to the usual bacilli. I said all the bacilli are gram negative except McDonald's, which is gram positive.